All right. Hello, families. I see y'all trickling in one by one. We'll give y'all a moment to get settled into our webinar for tonight. Hope you all are having a great evening so far. My name is Justin Barker. I'm one of the associate directors in the Office of New Student and Family Programs. Thank you so much for joining us for our Wellness at Duke session tonight. Y'all going to hear a wealth of information about student health and CAPS. So just to give you the lay of the land, oh, 1 second, there we go. So here's some Zoom features for the evening. You will have the ability to ask questions in the Q&A function if you see down there at the bottom of your screen. Some responses will be typed, but some questions will be answered live. Please do not put your questions in the chat function. And also, this webinar is being recorded. So we try to get this webinar up about 72 hours after we have completed the webinar. Also, just want to note this, the subject matter tonight, this information in student health and mental health can be very personal. So we ask that you do not disclose any personal kind of information in the chat feature. We will share with you some ways of how you can get in contact with the folks on campus to talk about all your health needs. All right. All right, friends, well, we're going to get this party started, and I'm going to turn it right on over to Melanie. Take it away.
Lovely. Hi, everyone. My name is Melanie Trost. I'm a family medicine physician, and I have been at Duke Student Health for the last 20 years, the bulk of my professional life. I love student health, and I love taking care of Duke students. So I would like to give a little bit of an overview of what student health does, and then we'll transition to sort of a view of our services, insurance, and pass off to our colleagues at counseling services as well. So this is the student wellness building that you can see all lit up at night. And student health is on the second floor of this building, accessible through this accessible access ramp that you can see lit up, that bridge. It also houses physical therapy, counseling and psychological services, a pharmacy. There are some dental services, other folks that live in this building. And does my advance the slide work, Justin, or should I cue you? So next slide. So you can see that student health is this beautiful purple star right opposite Cameron Stadium, if you know where that is on campus, and very close to the chapel and West Campus and Western Union, that sort of central campus hub. The emergency department, the hospital facility, is the star in red. So some people want to orient around the hospital complex. And then way over, you can see off Main Street is the East Campus star. And so our incoming freshmen living on East Campus, that's where the dormitories and the Marketplace food hall will be. But it's just a short bus ride into the main campus, and very centrally located to visit us at the Wellness Center and access all of those services. Next slide. So student health is open Monday through Friday, 8 to 4:30. On Thursdays, we open a little bit later because we do our staff meetings and our continuing education during that time. We are closed on the weekends, but there are a variety of ways for students to outreach and speak with a nurse to determine whether or not that might be something, if they have a concern after hours, whether to make an appointment when student health is next open, or either to make a trip to local urgent care or the emergency room. And those, you could see that red star, the emergency room is real close, right in the middle of the Duke building complexes. And there's urgent care quite close, and an orthopedic urgent care as well, quite close for sports injuries. Next slide. So at Student Health, we really do primary care. The main clinicians that work there are family medicine clinicians. They serve all ages. We take care of both incoming freshman students, the sort of transitioning early adolescents, 17, 18, 19-year-olds. And then also, however, we take care of graduate students and medical students, law students. So the whole kind of spectrum of folks enrolled at Duke. We do primary care services and can fulfill those needs. We also have some specialty or subspecialty kind of focuses. We do quite a lot of women's health because this is an age where that is decidedly a need. We do a lot of sports medicine. We have active students doing sporting things. We also provide nutrition counseling, and my colleague Franca, who's a registered dietitian, will be speaking with you all later. We also have a travel medicine clinic. I am the physician that has the certificate in travel health. And because we have students that are doing a lot of study abroad, a lot of summer philanthropic work, we do provide those pre-travel consultation services and immunizations and medications that would be appropriate to more exotic travel. We also, and I'm the physician liaison for the allergy immunotherapy clinic as well. For those students that are getting immunotherapy, we do provide a mechanism for connecting those home services immunotherapy that you're getting to transfer that care to under our umbrella at Student Health so that you don't have an interruption in that care. And on our website, there are some forms that are listed so that you could communicate with your allergist, get that information to us, and coordinate that care. Sorry. We also do laboratory and X-ray on site. And we do provide telemedicine services as well, usually a smaller number of visits, but these are really useful for folks that are wanting to have a brief visit in between things, not, maybe from East Campus, not getting all the way over to, to West Campus, and can have a follow-up visit or a discrete interaction with the provider over video visit. As well, we will be offering a Welcome to Student Health video visit this fall. And I'll speak more about that at the end, but essentially this is maybe thoughtful for folks that have a slightly more complex health history or really want to establish care with us and can do that through video visit. Next slide, please. So this is just us, the core team of physician providers. So Dr. Spots is our medical director. You can see me in the upper right. And we do have from family medicine some additional providers that come and do support services for women's health, gender affirming care, sports medicine, endocrinology. These are collaborators that we have brought over so that students that need a little bit more support in these areas will not have to travel out into the community to receive that care. Next slide. However, we will be able to coordinate referrals to the healthcare system at large. The Duke Health System is extensive, and we have connections throughout and can assist students in getting to the right spot for specialty care or community consults as well. Next slide. So in order to make an appointment at Student Health, we ask that you call our main number, which is 919-681-WELL or 9355. And then you just follow the prompts. Option 1 goes straight to scheduling. I know I need an appointment, and they'll just help you schedule that. Option 2 is the nurse triage line, and that allows you to have a bit of a conversation with a nurse. When our nurses are lovely, they all have a great deal of nursing experience in various fields and are very used to walking students through kind of that new to many students experience of, do I or don't I need an appointment? What qualifies in this collection of symptoms that should I wait or should I come now? Is this an urgency or emergency or maybe not? And they're quite skilled at walking through that. There are some appointments that are available online where the student can just log in and pick one of those through the Duke My Health portal. However, those are limited. And so in particular, if a student really feels like they need to be seen or they go online for the online appointments and it's like telling them 2-3 weeks out, do not sit on that. Call us, talk to a human. We will help you out. Next slide, please. After hours, we also have that telephone line covered. So we have contracted services that may not be our nurses that they would see in the day if they came in person, but well-trained staff that will help assess, is this a concern that should be taken care of in the after hours, or can assist in making an appointment with us in the near future. Obviously, emergencies, calling 911. And I'm going to hand this off now to Ellen Crawford, who will talk about immunization compliance, because I know that's probably very high on many people's minds as you're filling out all those forms.
Thank you, Dr. Trost. I'm Ellen Crawford. I'm one of the nurses here at Student Health, and I work in the immunization department. We realize that this immunization process can be very complicated and confusing and daunting, and we want you to know that we are here to help you through it. Justin, can you go to the next slide, please? Thank you. So the state of North Carolina does require that all incoming college students present certain documentation of certain vaccines, as well as a TB screening questionnaire. By law, students have the 30th day of class to fulfill the requirements, and if the requirements are not completed by that time, Duke has the right to remove you from class by state law and deactivate your Duke card. We clearly don't want this to happen to any of you or your students. We really encourage you to try to get all of this done early, get it done before you get here, so that once you arrive, you'll be involved in your orientation process. You will not have to be concerned about your immunization compliance. Hopefully, a lot of you, most of you, hopefully, have already submitted some of your forms. The next slide will kind of walk you through the instructions on how to submit your forms. Justin, if you can go to the next slide. Thank you. This is on our website. Essentially, what we ask you to do is to get your provider to fill out Duke's immunization form. Then we want you to log into your Student Health Gateway and upload the form. Give us about 7 to 10 business days and our staff will review your form, and then we will send you a message on that gateway letting you know either that you have met all the requirements or that you are lacking something. If you are missing something, we're going to give you a detailed message on what is needed. So my biggest advice here is, once you submit your records, please keep an eye on your email. Duke will send you you'll receive a Duke email that tells you to log into your Student Health Gateway, and that's where you will find your secure message. We don't want to communicate with you directly through your Duke email because of the fact that it is medical information that we would like to stay confidential. I would say from experience that what gets most people into trouble is just not reading the email and reading the messages and understanding what is needed. Once you do receive that message, you will then also have contact with one of our staff members that you can continue to communicate with any questions regarding your requirements. You can also always email immunizations@duke.edu. We will be happy to help you as much as we can through email, and if a phone call is necessary, we're happy to do that as well. Next slide, please. Thank you. All incoming students do have to complete a TB screening questionnaire, and that questionnaire can be found on our website. If indicated, TB testing would be required in the United States and dated after March 1st of 2025. So all the international students will have an opportunity to receive that TB testing when they arrive at Duke. There are also some vaccines that are required by North Carolina that are not available in some other countries. So please know that we will help any of you that need that help at our immunization clinics in August. For all of the domestic students, we really encourage you as much as possible to complete your requirements before you get here. If that is not possible, there are a couple of ways for you to complete them once you arrive at Duke. Next slide. Listed here are some immunization clinics that we have scheduled. These are walk-in clinics, and they will be at Penn Pavilion, which is located between Student Health and the Duke Chapel. You can see the hours here. It's a walk-in clinic, so do come with any records that you may have not submitted, and come with a lot of patience because there are usually a lot of long lines here. We will get to you, we will get through you, and we will help you. If you arrive earlier than these clinics, please try to schedule an individual appointment with us. And again, you can call that main number, 919-681-WELL, 9355, and we will help you schedule an appointment with our immunization nurse. And I'm happy to help answer any questions later in the webinar, or please direct anything to immunizations@duke.edu. And now I will pass this over to Calvin, and he will help you with the student health insurance.
Hello, everyone. I'm Calvin Vini, Insurance Care Specialist here at the university, and we're going to briefly go over some of the student health insurance information for you tonight. Here, we prioritize the student's health and well-being. So we want to make sure that your student is getting the care that they need. Of course, without insurance, things can get pretty costly. Not just them being pretty costly, but also it affects your students' health and well-being. We want to ensure that all students have adequate health care coverage, either through the university or if they're using their own private insurances. If they're using your own private insurances, you can either choose to enroll or waive out of the university insurance plan. Next slide, please. The annual plan year runs from August 1st, which is the first day of the school benefit year, till July 31st, which is the last day of the school benefit year. The annual premiums are listed on the screen as you see. For the students, it is $3,751.56, and that's for the entire school year. The spouse, to add a spouse or dependent, the rates are as follows: $3,577.74 for the spouse. For a child or children, it is $3,992.15. That is for one child or 50 children. The rate doesn't change. It will be that one rate. To add a spouse and children, it's the $7,625.61. We do offer a dental insurance package with Aetna Dental students, and the dental premium for that is $353, and that is for the school year August 1st to July 31st. Next slide, please. At student health, we have certain waiver criteria that have to be met. This is not just at student health, but this is for Duke Health overall. The waiver criteria have to be met in order for students to be granted an insurance waiver from the student health policy. You cannot be a F1 or J1 international visa holder. The plan must be compliant with the Affordable Care Act. Just to go over a few, the policy is not a travel policy. The coverage must be in effect for the entire school year, August 1st to July 31st. There has to be prescription medication coverages as part of the plan, and that the plan provides in-network coverage for routine or primary care services, as well as emergency care and mental health benefits in the Durham area, to include Duke Health as part of the waiver criteria. Medicaid, out-of-state Medicaid and the CHIP program will not, and HMOs from other states will not meet the Duke Health waiver requirements. With the Medicaid, they normally don't have benefits outside of the host state. And the same thing with the CHIP and with the HMOs, they normally don't have benefits outside of the home state, so they will not meet the Duke Health waiver requirements if they're not from within the state of North Carolina. Next slide, please. Students are able to waive during the annual enrollment period. The enrollment period began mid-June, about June 11th, and that'll continue until September the 15th. To submit your waiver request, you would go to the Gallagher link that's posted on the screen. the www.gallagherstudent.com/Duke. It'll take you right to a homepage where it says Welcome Blue Devils. You would have to log into that page using some information that the student will have access to, and they can submit their waiver request through that waiver link. There's some questions they would have to answer and upload a front and back copy of their insurance card for proof of insurance coverage, which is checked by the Gallagher system. The fall enrollment and waive period is once again mid-June and ends September the 15th. Students will receive email notification through their Duke email accounts once the portal had opened, which some of them have already received. If they're late enrollees, they'll still get the email to submit their insurance waiver request up until the last day of the enrollment period, which is September the 15th. They'll get reminder emails in the meantime to remind them you need to complete the steps. Failure to complete the steps can result in automatic enrollment. We just want to make sure that your student has adequate healthcare coverage for their time here at the university. Next slide, please. On the screen, you actually see our student affairs website where you can actually go to enroll. The QR codes that are on the screen are active, so you can actually scan the QR codes if you need to enroll into their program. The Gallagher student portal, there is the QR code that is active. That is what the actual screen looks like when you actually go into the Gallagher link from the previous slide. You will see that Welcome Blue Devils, and you would just click that login button. And then from there, it will prompt you on what's information that they would actually need from your student in order to proceed through the website. Oh, one more thing. Can we go back to the previous slide? And I'm sorry I failed to mention that to contact us, the shs-insurance@duke.edu is a way to get in touch with us. If you have any insurance related questions regarding your waiver, if you have any questions regarding insurance coverages, we're more than happy to answer as many insurance questions as you have as possible. So we want to make sure that you understand the insurance to the best of your ability. We understand that you're not going to understand everything, but we're here to break it down for you as much as we can to help it be a little bit more easier to understand and to navigate to the best of your ability. And now I'll
Great.
pass this on over to Franca, our
Thanks,
nutrition
Cal.
specialist.
Thank you, Calvin. Hi, my name is Franca Alphin. I'm a registered dietitian and the Director of Nutrition Services at Student Health. If you can go to the next slide, Justin, that'd be great. So to simplify everything, this is if you scan the QR code, or you can go to the Duke Student Health website. We have a link on the left side, which is nutrition resources. We have a wealth of information on our website for people who might be interested in just perusing to see what's on there. It also shows you how to make an appointment. So unlike what Dr. Trost was saying, calling Student Health, which of course you can do, you can just go to our website and there is a link there and it allows you to make an appointment through that link. And then we'll reach back to you to set up that appointment. These services are for any student. They're paid for as part of your health fee. This is not through your insurance. And we see students for any reason at all. Some are just curious about what do you do when you meet with a dietitian. Other students may have medical conditions that warrant nutrition support. Some people struggle with weight. Some may struggle with eating issues. So we are happy to meet with students for any reason at all. And just scanning the QR code and looking at the website will give you a lot more information. So we look forward to meeting with any of your students that want to meet with us. And I will turn it back over to Dr. Trost.
Hello again, everyone. So I did want to clarify as well, because I saw some of the things in the Q&A. So the student fee basically provides for access to the wellness center. So in sort of simple terms, by being an enrolled student and paying the student health fees, you get in the door to see me. I will talk with you. I will assess and do the things that you would do in a doctor's office. And then if we decide, oh, you need a X-ray or an ultrasound, then those things, those additional services would be billed to the student's insurance, right? there are a few things that are straightforward that are done on site just because we have them on hand and they're easy and we don't do bill for them. But for the most part, things like laboratory, things like consulting specialists, other things, that's when the insurance gets activated. But if you want to come see me, talk about something, get a prescription for your strep throat or your UTI, then that all gets handled under the sort of visits for within the health fee. So then my last note is that these Welcome to Student Health video visits, this is a thing that we would encourage folks that have a more complex health history, something where you would want to have the providers at Student Health understand your historic regimen of treatment, your list of medications, recurrent visits or follow-up plans that you have for particular ongoing or chronic conditions. To set up one of these welcome visits, then again, you just call the main number, choosing option 2 to talk to a triage nurse, and say you'd like to have that Welcome to Student Health visit, televisit to establish care. And that will allow us to set up a nice half-an-hour block of time to basically build a chart for the students so that we are not having to also do that in the next moment, maybe when there's a crisis or something is going on or some condition flares, that we already know the student, we already have a chart built for them, we can receive them with a little more aplomb. And we look forward to seeing all of you, or hopefully not seeing all of you if you all stay well.
All right, I think it's on me. Hello, everyone. My name is Ty Strong-Lodor. I am the Assistant Director of Communication and Outreach here at Duke's Counseling and Psychological Service Offices. And I am also a licensed marriage and family therapist. And I know it just sounds like I only do couples and families, but I actually specialize in working with emerging adults, as many of our clinicians do. So next slide, please. So I would like to give a big shout out and huge thank you to the student health staff for thoroughly explaining where we are located. To further seal the deal, we are all located in the same building. But to further seal that deal, what I often tell students is that the massage chairs are located on the first floor. Student health is located on the second, and then you will find the CAPS office on the third floor. We are open from 8 a.m. to 5 p.m. Monday through Friday. Students can receive care between the hours of 9 a.m. to 4 p.m. in person during that time. However, CAPS does function as a 24/7 crisis management center. So what that means is that after hours, students can call the CAPS office, and I believe I have that number here, 919-660-1000. They can press option 2 and be connected with the on-call counselor. And so when we're talking about the clinicians that we have a multitude of clinicians to represent the different areas of the field. And so like myself, a marriage and family therapist, we have social workers, licensed mental health counselors, psychiatrists, psychologists. We really try to run the gamut and offer our services to students. Next slide, please. So services that we offer, that crisis assessment, confidential 24/7, right? And so between the hours of 9 and 4, let's say your student is not feeling their best selves and they're wanting to talk to someone, they are feeling extreme stress, they're feeling hopeless, and they're a little concerned. They can come into CAPS and be seen right at that day. Now, we do ask that students have a little bit of time reserved because we do need to get some paperwork filled out. So think doctor's office, kind of that demographic information, what's going on, how can we help you? But after that, students will meet with one of our licensed clinicians, and they'll be able to assess, okay, is this crisis? Do we need to do something right now? Students are being stabilized in that moment, and then figuring out the next steps. And so what is the best step for your student? Is it brief individual counseling? And by brief, what I mean by that is students tend to present with a specific issue. Students and their therapists will work through that issue, and therapy then resolves upon that issue being resolved. And so let's say we have a student who is homesick, feeling lonely, not being able to function in class so much because they're so distracted by their loneliness, right? The clinician will take that time to work with them through that process. And once the clinician and the student have decided, okay, I've learned the strategies, I have the skills, I feel comfortable with moving forward and doing the work on my own, then the therapeutic relationship will be terminated. Students also have the option of being referred out to different counselors in the field. And so we have a panel that we vet that take the Duke Health Insurance, and we work with students to connect them in that way. We also work with clinicians in the community and help students find clinicians that take their insurance or if they're on their parents' insurance, and figuring out what that looks like. Is group therapy best for your student? Throughout each semester, we offer an array of groups that target interpersonal connecting, that target learning how to build distress tolerance, groups that target even just connecting with yourself and a way to strengthen how you connect with others and show up for yourself and others on campus. Medication evaluation. So as I said, we host psychiatrists within our building as well. Students are able to transfer their care to our psychiatrists. And in fact, we do ask that if a student is wanting to see our psychiatrist, that they are willing to transfer that, right? So that they are only working with our psychiatrists. Of course, with the release of information and all of that, our team can work with who your student previously saw to make sure we're continuing the care that works best. But we are able to do that. And sometimes we also refer students to just campus resources, right? I don't know if you all have learned about DuWell yet, but DuWell is one of our preventative offices that teaches students different meditation skills. They have an array of events for mindfulness. So getting your students some skills throughout the way that say, okay, maybe I don't need one-on-one intense counseling or therapy, but I would still like to learn some skills in community with other students, and we are more than happy to refer them there. CAP services are free of charge, which is to say that it is included in the student health fee. And so that as long as your student is enrolled and paying the student health fee, they have access to our services. Next slide, please. Another resource that we have is, okay, another resource that we have access to is Timely Care. And so thinking back, and I don't know, I think about my first year on campus, and I wanted to do everything and be everywhere. So I did not have time for a counseling session that fit between the hours of 8 a.m. and 5 p.m. And so for those students who are unable to do that, Timely Care is one of the resources that we're able to refer them to. Timely Care allows students to be connected with students in the community, with clinicians in the community. They can connect for about up to 12 free sessions. And so similar to how we work within office, those sessions are included in the student health fee. As long as a student is enrolled and paying the student health fee, they have that access with Timely Care. Another function that I hear some students talk about is the Talk Now function. Think like a peer crisis line where you're able to talk and connect with someone. Their Talk Now function is done by trained professionals, so not really peers, but students find that they like that function when it's about 12, 1 o'clock. They're a little stressed, but not too high stress, but wanting to just talk some things out. And they find that they like that. And I also want to throw in there, as you all are getting this information, your students will be hearing about this for weeks and weeks and weeks to come as soon as they get on campus, because we are everywhere. Our clinicians work with housing. Our clinicians work with the different wellness units. Our clinicians work with the different departments across campus. And so your student will be hearing quite a bit about CAPS and all the different ways that we can help them. Next slide, please. Hosted within our center is the Gender Violence Intervention Coordinator. And so that is currently Amy Jandro. She is a licensed clinical social worker who specializes in helping students work through gender violence issues. Students are able to utilize her as a confidential support resource. She will work with them throughout any processes that they may need assistance with. She can also help connect them with others. We also have, in accordance with this, we have the Gender Violence Education and Outreach Office. our offices work together to make sure that we're getting this information out to students. And so this is something else your student will have access to. Next slide. So just want to insert this. I often think about the things that parents can do to help us support their students, to help us better support their students. And one thing that I tend to ask of parents is to please help us normalize the process. Help us in encouraging your students to say, hey, if you need a little bit of help, these are the resources available to you on the campus. Let's try reaching out to some of these resources. Sometimes that transition can be a little tough. Students are trying to make new friends. They're wanting to be standouts. They're wanting to get engaged in all of the things. And that can come with some wear and tear on their psyche. And so I just ask for parents, when you're making your time and you're giving them that phone call, try checking up with them. And if things don't seem too okay, please encourage them to come and see us.
Awesome. Thank y'all so much, team. I really, really appreciate it. That was awesome. Great information. And the chat and the Q&A have been rolling. So this is a survey for later. This is just going to be on our screen until we get through the Q&A. But we have some time right now to answer any questions that you might have. And remember, let's try to keep our questions, general. We don't want to ask too many personal questions, as these topics often are very, very sensitive. The team gave how you can reach out to them. But I want to answer this first question right here, which is, are we going to get copies of the presentation and a recorded video? Yes, you are being recorded right now. You are on candid camera. You didn't even realize it. So yes, this will be recorded, and we try to get this uploaded to our website within 72 hours, if not sooner. So as soon as this is done, we will download it and work our way to get it up on the website. Ty, real quickly, could you go over specifically if a student wants to have ongoing mental health counseling services, like how many sessions do they get, or what does that process look like?
So again, we do not have session limits. I am very proud and very happy to say that we are a service that does not present with session limits. What we have found, though, is that students tend to drop off around maybe between section 6 and 8 because they feel that they've resolved their issue. And so what we do is, when we get students in through that door in the beginning, we're working and we're going. We're scheduling in accordance to the student schedule as well as ours, because each of us carries a caseload. For the most part, students are seen on a biweekly basis. And when we're doing that, we're going. And then students tend to say, okay, I feel a little better about this. I feel a little different. And so we test it out, right? Okay, let's push this out about another week. So let's see where you're at week 3, schedule you to come back in, and let's see where you are. If the student was reporting that they're okay, they're ready to move forward without therapy, then we're terminating services. If students are finding that they are wanting to do some deep ongoing work, and so we're talking about that heavy trauma work, things like that, then we have a conversation with the student. We assess what the student's resources are, the reality of those resources, and then we talk about whether they are best fit for us or if we're doing bridge care until they are in a place where they're ready to see a clinician in the community who can do that deep ongoing work for them.
Great. Thank you so much. Let's see. A lot of our questions have actually been answered, and we love that. Let's see if there's any in the chat that I might be missing. Do, 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 do. Do, 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 do. All right. Any other questions? Well, friends, if you have any, Does every student pay the health fee, even if we request a waiver from the Duke Student Health Insurance?
I can answer that question. Yes, if your student is living on campus or within the campus area that they're taking their classes on campus, the health fee will be applied to the student's account. Even if they waive the student insurance, the health fee will still apply. So they can still use the health fee to visit Duke Well, Duke Reach, CAPS, and Student Health. Once again, with the health fee, we don't bill insurance unless you're getting labs, immunizations, vaccines, travel vaccines, or x-rays. If you're not getting any of those services, then the health fee will, in essence, is like a semester-long copay, will cover you while you're visiting our facilities.
Great. Thank you for that, Calvin. Awesome, friends. Well, I'm not seeing any other questions in the chat. That means we did our due diligence and did a great job. But if you have any questions and we want to triage it to our folks over in student health, you can always email us at familyprograms@duke.edu. I want to also plug, if you are not in the 2029 family Facebook page, get in it. So much information is presented on that Facebook page. Penny would love to have you. Also, like I said, this will be recorded, and our friends are available there to help you. And if y'all could do me the biggest favor, if you could scan this QR code and fill out our parent and family orientation survey about this webinar so we can know all the information and so we can get better and just try to help better support you, okay? My friends, thank you so much for being here. If you need anything, y'all just let us know, okay? It was a pleasure. And we'll see you next week for the next webinar. Bye, everybody. Okay, let me stop the share. Stop the recording.